Good morning. Greetings to one and all gathered here. It gives me an immense warmth and great pleasure to grace all of your presence after a long time. Last year, our Department of Biotechnology had successfully conducted the Biotalk series, and now, once again, we are ready to roll with Biotalk series version 2. In our midst, we have an eminent person, Dr. Selvaraj Arokiraj from South Korea, who is going to speak on the topic Impact of Herbal Medicine in COVID Management. Now, I call upon our HOD, Dr. Sri Kumar, to inaugurate this event.
Thank you, Alfred. Good morning, my dear students and staff members. Hope everything is going fine and safe. I'm happy to see you all in this virtual BioTalk lecture series, version 2.1. For the sake of invited speaker, I wish to highlight some of the credits of our college and the department. St. Joseph College of Engineering is one of the top colleges in India with 160th position as per the NIRF ranking, and it has got 27 years of reputation in education society with NBA and NAC A plus grade accreditations. It is having 10 UG programs and 7 PG programs with an affiliation from Anna University Chennai. Recently, we have got autonomous status also from UGC, which will be implemented from the forthcoming academic year. Our Department of Biotechnology started in the year 2002 and having BTech and MTech biotechnology programs in it. Since inception, we have bagged 139 university ranks with 10 gold and 7 silver medals with the consistent results of 100% pass percentage every year. The department has got a sophisticated laboratory and fetched research center recognition from Anna University to do PhD program and MS program by research. We have more than 1.2 crores of government funding for conducting research. It is a well-known fact that the current pandemic outbreak has paralyzed the entire world into standstill and enforces a sort of psychological burden in the minds of academicians and students. Despite this unforeseen situation, our biotech department still wishes to keep our students educated about the ongoing research and developments occurring around the world. Our department has the practice of conducting BioTalk lecture series by bringing eminent biotech personalities through the webinar and sharing their research views to the entire biotech community that includes students, teachers, and research scholars, etc. So far, we had successfully conducted several programs and received good responses from the participants. We wish to continue the same during this second wave of outbreak also in the name of Biotech series version 2.0. And today is the lecture going to be the first in the new version of this lecture series. The topic is going to be impact of herbal medicine in COVID management, which is highly relevant to the current therapeutic need of the world. In order to give more authentic research-based explanation about the use of herbal medicine, we have Dr. Selvaraj Arokiraj sir, Assistant Professor in the Department of Food Science and Biotechnology, Sejong University, Republic of Korea. On behalf of the patrons, Dr. B. Babu Manoharan, Jessie Priya, Managing Director, and Mr. Sashi Shekhar, Director, Dr. V.S. Rao, Principal, Dr. Parvadardhini, Dean, I welcome the speaker, Dr. Arokiraj, and all the participants to this BioTalk series. I also convey my warm felicitation to Dr. Justin Pakia Jacob and his organizing team for this webinar. All the best. Now, I ask the student coordinator, Mr. Alfred Francis, to give a brief introduction about the invited speaker. Over to Mr. Alfred. Thank you.
Thank you, sir. Dr. Selvaraj Arokiraj has completed his bachelor's in microbiology and master's in biotechnology from the University of Madras and went on to pursue his PhD from Satyabama University in the field of microbiology. After which he worked as an assistant professor in Vailtech iTech Engineering College, Chennai. And from there, he went on to pursue his postdoc from various institutes such as National Institute of Animal Science, Republic of Korea, Seoul National University, Republic of Korea, and also from the National Cancer Center. He is a proud recipient of various awards such as the Bharat Seva Ratna Award in the year 2014 and Best Teacher Award in the year 2013 by Education Today magazine, and also is a recipient of various seminar grants. Dr. Selvaraj has more than 80 SCI index publications, more than 2060 citations, and 1,500 plus publications in renowned journals. Last but not the least, he also a real-life hero who went viral in both national and international media by saving a 5-year-old child from drowning in the river Han in Seoul. And currently, he is working as an assistant professor in Sejong University, Republic of Korea. Sir, it is an immense pleasure to have you here with us today. I request you to take over the session. Thank you, sir. Sir, please unmute your mic, sir.
Okay, shall I start my session?
Yes, sir, you can, sir. I'll give the controls to present, sir. One second, sir.
So what is where is the
Yes, sir, you can present, sir.
Okay. Okay. Just I need to give some introduction. So first of all, I thank the respected chairman, principal, then Dr. Babu Manogaran, and HOD Dr. Sri Kumar, Dr. Justin, Dr. Renuga, the faculty members and students of biotechnology for organizing this Biotech Series 2.1. I think like a first generation, second generation, third generation technology. And I think I'm very happy to see this Biotech Series 2.1 version. So I appreciate the department because even in this pandemic time, faculty members, particularly from the private institution, they continuously working. So it is first of all, it's my royal salute for you people, because during this pandemic time, I know most of the private institution has been affected, particularly the faculty members, both economically and also psychologically they have been affected. So even though you have many problems, but you people continuously promoting and motivating the students, that academic thing, and also you're providing the moral support, like organizing this kind of conference. In Tirukural, there is a word, Ulakathoda Otta Odugal. Okay, so Ulakathoda Otta Odugal means, so we need to adapt the recent technology, modern technology, and also we need to update every day. So it is not only for the students, and also for the faculty and for other people. So we need to update. So once if you update, our growth will be continue. Once if you're not updating, automatically our growth will be suppressed. So this kind of conference, it is an easy platform for the students and the faculty for exchanging the ideas and knowledges. And also, Dr. Sri Kumar mentioned about the biotechnology department. I think really your department in your university or colleges, I think you're rocking. You're giving 100% results and also 1.2 crores project. It is not an easy task. Okay, here I need to mention the point. Compared to many central and state funded universities, you people are really doing a very good job. In the case of publications, in the point of patent, and also in the point of student for getting the job opportunities or for higher opportunities. Really, you're doing a very great job without any expectation. And the student point of view, I think you people, most of the students, you miss the most thing. The most important thing is the food. I think you since there is no college, you people miss the food, because since I completed my PhD in Satyabama University, and I'm proud to say I'm the first life science PhD student. Okay, in Satyabama University, I'm the first PhD students in full-time candidate. Okay, so I know the taste of our JPR institution, the quality of food, and also the students can enjoy another thing. So now students, they feel free. I think there is no any regulation. You need to wear good shirts, formals, other thing. There is no any strict regulation by the faculties and the management. Okay, so next we can go to the session. So my screen is okay? Is it visible?
Yes, sir, it is visible, sir. Yes, sir, it is visible.
So how many students are there? I need the session to be interactive, okay? Because I don't want to be like purposeful, like any academic time. It should be a interactive session, and it should have some very, very good outcome. Okay. So in case if you have any queries or anything, you can stop me, and also you can ask me at any time. Okay. So today the topic is impact of herbal medicine during the COVID management. Okay. So I don't want to give much introduction, because you people gave a very good introduction about me. So today highlight of these topics I used to discuss about what are the importance of medicine plants and use of medicine plants in viral prevention and treatment, and what are the techniques involved in the isolation of compound or plant compound isolation, and job opportunities in pharma and higher studies opportunities, particularly in South Korea. Okay. So before starting my session, I used to thank this kind of biotechnology people. So now our Tamil Nadu government and government of India, they used to thank like the frontline workers. The real frontline workers are who means the biotech people. So you need to feel proud. Most of the microbiologists, virologists, molecular biologists, and you people are doing a very good contribution in controlling the COVID, identifying the COVID, and managing the COVID condition. Okay, so because if you want to confirm whether you have the corona positive or not, you need to do the PCR analysis, RT-PCR analysis. So who will do that PCR analysis? It is not a doctor, it is not an engineer, it is not a nurse. It is only the you people like biotechnologists or microbiologists or people from the life science background you can. So you are the real frontline workers. So my sincere appreciation and congrats for the students who took this biotechnology course. And next, and today in this pandemic time, I think most of you can see last 20 or 30 days before, most of the North India, particularly Uttar Pradesh, Bihar, Rajasthan, most of the North Indian state has been completely, they have been a very difficult condition. The number of COVID infected cases has been increased, and also the number of deaths also increased. But comparatively, in Tamil Nadu, we can able to manage. So because thanks to our politicians, we are able to manage, because compared to other province, Tamil Nadu they have a very good health system. So because of the very good health system, now we can, at least we are surviving. So before making into my topic, so I need to give some 2 or 3 points about the COVID analysis. So because now this is a serious time and serious condition, and most of the people, our relatives, our family people, our friends, most of the people, they will be affected. So this kind of information, kindly make a note. So here, there are many death cases, COVID cases, who if the patient is admitted with COVID condition and he is under the hospital condition. So mostly there is a data, it shows us particularly the COVID patient who have the ventilator support, oxygen support, they used to die during the early time, 1 a.m. to 5 a.m. Okay, so this is the time they used to go for, they want to refresh, they used to go for the washroom or toilet and bathroom. So during that time they feel something, so they used to remove the oxygen mask, and that time it was critical. So once they remove the face mask, they used to go for the washroom, So while doing that activities, so that time they used to make some. So automatically the oxygen has been decreasing. So the patients die. So this is the thing. Okay. So இதெல்லாம் பார்த்துங்க, முக்கியமான விஷயம், யாரெல்லாம் வந்து உங்களோட ஃபேமிலிஸ் ஃப்ரெண்ட்ஸ் யாரெல்லாம் ஹாஸ்பிட்டல் அட்மிட் ஆனாங்கன்னா அவங்க கோவிட் பேஷண்ட்ஸ் ஆக்சிஜன் சப்போர்ட்டோட இருந்தாங்கன்னா கண்டிப்பா அவங்க வந்து மாஸ்க் வச்சுட்டு சொல்லுங்க. பாத்ரூம் போடும்போது இல்ல வந்து டாய்லெட் போகும்போது பார்க்கும்போது அதை எடுக்க வேணாம். அப்படி எடுக்கிற மாதிரி இருந்தா கூட பக்கத்துல யாருன்னா டாக்டர்ஸ் நர்சஸ் வச்சுட்டு பாருங்க. ஏன்னா நிறைய கேசஸ் ரிப்போர்ட் என்ன இருக்குன்னா அந்த காலையில 1 மணில இருந்து 5 மணி வரைக்கும் பார்க்கும்போது பேஷண்ட்ஸ் அவங்க பாத்ரூம்ல நிறைய பேர் இறந்து கிடக்குறாங்க, தெரியவே இல்லை. அது என்ன ரீசன் கேட்டானா அதை எடுத்துட்டு அந்த டைம்ல பார்க்கும்போது அவங்க டாய்லெட் போகும்போது அவங்க suddenly oxygen drop ஆயிட்டு they expire. Okay, so another important thing I need to share in this pandemic condition, there are the points we need to mention. You need to provide to your family members. Okay, the first thing, fear and panic. பயமும் பதட்டும் வேணாம். இந்த கொரோனா காலத்துல பார்க்கும்போது நிறைய பேருக்கு வந்து எல்லாம் பயம் தான். கொரோனா கொள்றதோட பயம் தான் எல்லாருமே கொள்ளுது. So many people they once they have the corona positive or even they have give the sample for corona negative, they are very panic. Okay, I can give 2 examples. The first one example is like this happened recently in my family members. The case 1. So one of my relative, his boss has been admitted with corona positive. Okay, but my relative, he gave the sample for testing whether he's having corona positive or negative. So the lab technician, they came from the municipality and they took the sample at 10 a.m. Then they told my relative, okay, you will get the result at 6 p.m. So between 10 a.m. to 6 p.m, my particular relative, he was completely stressed because he wanted to think about, he was very much worried about whether he will have the corona positive or corona negative. If I have corona positive, what my family members will think, what my surrounding neighbors will think, what my economical will happen. So this kind of thinking was thinking continuously. But the result, he didn't not receive the result at 6 p.m. But he received the result at 11 p.m. night. The result was COVID negative. Then what he did, he was continuously calling to everyone. My result was negative. So the full early morning he was not sleeping. And the next day early morning at 8 o'clock, his BP was raised and he left unconscious. Okay, so the point is here the corona is not an issue. Because of corona panic, he got stressed. This is another thing. And another point, many people, they are not don't believe any WhatsApp message or WhatsApp or Facebook or YouTube message. Don't believe anything. Okay, so 95 to 94% of COVID, if you have COVID positive, nothing to worry. 95% to 94% of COVID patients, they don't need to go to hospital. So most of them, they may have mild COVID infections or moderate COVID infections. Okay, so you can be in the home quarantine for 14 days. So remaining 5% or 6%, they need to go to hospital. For those persons, you need to continuously monitor the oxygen level by oximeter. So this is a very important thing. Okay, so don't be overconfident. நம்மளுக்கு எதுவுமே ஆகாது அப்படின்னு நினைக்காதீங்க. நம்ம இந்த மாதிரி நாட்டு மருந்து சாப்பிடலாம், இல்லை எது சாப்பிடலாம், அதெல்லாம் நம்ம இது பண்ணாதீங்க. Once you have COVID infection, COVID positive, உங்களுக்கு COVID positive வந்துடுச்சுன்னா உடனே நீங்க மருத்துவரை போய் பாருங்க. மருத்துவரை பார்த்துட்டு மருத்துவர் ஆலோசனை என்ன சொல்றாங்களோ அதை தயவு செஞ்சு கேளுங்க. இந்த வாட்ஸ்அப், ஃபேஸ்புக் அதெல்லாம் பார்க்காதீங்க. ஏன்னா என்னோட நிறைய பேரை நான் பார்த்துக்கிறேன். இது பேர் அவங்களோட அலட்சியத்தால நிறைய மரணம் நடந்திருக்கு. இது okay. So this thing you can this data. So this is the list, particularly in Tamil Nadu. What are the government hospitals which have the bed availabilities? Another thing. So if you are under the quarantine for 14 days, those people who have mild or moderate infections, you need to take the Cabazapur as per the government, and you need to the optimum dose is 40 to 50 ml. 40 to 50 ml தான் குடிக்கணும். நிறைய பேர் இந்த பயத்துல போயிட்டு லிட்டர் கணக்கா குடிச்சிட்டு இருக்காங்க. So it gives to other complications. So that is the important thing. And you should have a very good food. Okay. ஸோ நல்ல சாப்பாடு, நல்ல ஒரு சப்போஸ் ஆட்டு இறைச்சி இல்லை மாட்டு இறைச்சி அந்த மாதிரி நல்ல சூப் ஐட்டம் நல்லா சாப்பிடுங்க. அந்த மாதிரி இது அந்த யூ டேக் லாட் ஆஃப் ஃப்ரூட்ஸ் அண்ட் வெஜிடபிள்ஸ். டோன்ட் டேக் ஃபுட் இன் ஹோட்டல்ஸ். வெளியே என்ன சாப்பிட தேவையில்ல. And compulsory you need to, if you have a COVID infection, you need to self quarantine within a room. Okay, so use face mask. Other thing, so if you have some initially at the initial point, if you have some like difficult for things, like you can have the steam inhalation. Okay, but be careful. Open the doors and windows, because for COVID times the aeration is very important. Another thing, so once the people you have, if you have elder person in a home above 45 or 50 means, kindly mention any ambulance number or the person who knows for driving. யாருன்னா வண்டி ஓட்ட தெரியுமா வச்சுங்க. அப்புறம் ஆக்சிமீட்டர் அதை பார்த்துட்டு கண்டினியூஸ் செக் பண்ணிட்டே இருக்கு. You need to check the oxygen level continuously. If the oxygen level goes below 95 or 90, definitely you need to admit to the hospitals. So don't make overconfident. ரொம்ப திகிரமா நினைக்காதீங்க. கொரோனாவுக்கு எதுவுமே கிடையாது. கொரோனா பொறுத்த வரைக்கும் எதுவுமே அவங்களுக்கு வந்து பணக்காரன் படிச்சவன் படிக்காதவன் எதுவுமே தெரியாது. So immediately you need to act. So this is the thing. So why I am telling means, most of the cases, death cases reported because of this kind of overconfident, then not believing the doctors. So they used to do the self treatment. So that is the thing. Okay. So now those people, those who have the opportunity to go for vaccination, definitely need to do for vaccination. So since you are molecular biologist, biotechnologist, I need to give some introduction. So vaccination for COVID vaccine, these are the common vaccine, mostly like a live vaccine or adenovirus vaccine, DNA vaccine, virus-like particle vaccine, subunit vaccine. These are the common vaccination. And now people have fear for vaccination. Okay, so vaccination is not in order to be panic or anything. So this is the general mechanism of vaccine. So you can see. This is the RNA, any type of vaccine. If you take, if the patient is injected with vaccination, so what happened? The vaccinate, the body, our body will automatically produce some antibodies. Okay, so antibodies. Next, if the same patient, if you expose with the COVID virus, so automatically the antibody secreted in our body, it will fight against the COVID vaccine. Okay. ஸோ இப்போ வேக்சினை பற்றி நிறைய பேருக்கு ஒரு புரிதல் இல்லாமல் இருக்கிறாங்க. அது ஒன்றும் பெரிய இது இல்லை. வேக்சின்றது ஒரு சிம்பிள் கான்செப்ட் தான். ஒரு பாம்பு இருக்கு, பாம்புக்கு பல்லுல விஷம் இருக்கும். ஓகேவா? இப்போ பாம்பு இப்போ நிறைய பேருக்கு ஒரு புரிதல் இல்லாமல் இருக்கும். இப்போ வந்து லைவ் அடினேட்டர், ஃபார் எக்ஸாம்பிள் அடினேட்டர் வைரஸ். ஓகேவா? இப்போ இந்த அடினேட்டர் வைரஸ்ன்றது ஒரு பாம்பு, ஒரு நல்ல பாம்பு வச்சுக்கிங்களேன். இப்போ அந்த நல்ல பாம்பு அது கொத்தனா விஷம் வரும், விஷம் ஏறும். அந்த விஷம் எங்க இருக்குன்னா அந்த பல்லுல இருக்கும். இப்போ என்ன பண்ணுவாங்கன்னா அந்த பாம்பு, நல்ல பாம்புடைய பல்ல பிடிடுவாங்க. ஆனா பல்ல பிடிக்கினாலும் பாம்பு தான், அந்த பயம் இருக்கும். ஸோ இது ஒரு கான்செப்ட். ஓகேவா? ஸோ இப்போ என்ன ஆகும்னா, இப்போ நம்ம உடம்புல வந்து இப்போ இந்த வேக்சினேஷன் அப்ப என்ன பண்ணுவாங்கன்னா, இதே மாதிரி ஒரு வைரஸ், இந்த கொரோனா வைரஸோடைய அதை வந்து வீரியத்தை கம்மி பண்ணிடுவாங்க. ஓகே, ஈவன் இஃப் யூ இன்ஃபெக்டட் வித் வேக்சினேஷன், அதனால தான் உங்களுக்கு வந்து வேக்சினேஷன் போட்டா அந்த கொரோனா வைரஸ் என்னென்ன சிம்டம்ஸ்லாம் காட்டுதோ, என்னென்ன அறிகுறியெல்லாம் காட்டுதோ அந்த உயிர் காட்டும். So if you vaccinate, that is the reason. If you vaccinated, you feel body pain, you feel fever, you feel muscle pain and other thing. But you will not go for the life threatening. உயிர் இழக்கிற வழக்கு இருக்காது. அது ஏன்னா அந்த வைரஸை வந்து நம்ம வீரியத்தை கம்மி பண்ணிடுறோம், நம்ம அந்த வைரஸ் வந்து உள்ள செலுத்தி விட்டுறோம். அப்ப அந்த வைரஸ் உள்ள செலுத்த உடனே நம்ம உடம்புல இருக்கிற நோய் எதிர்ப்பு சக்தியில் என்ன பண்ணும், it will make an antibodies. So that is the reason. Okay. So people who have the opportunities, kindly make a vaccination for 2 doses. And before things, you need to understand the structure of SARS coronavirus. So this is the structure of SARS coronavirus. So spike protein. So these are the major important protein of SARS coronavirus. Spike protein, then nucleic acid. So here it is RNA virus, then membrane protein and envelope protein. Okay. So these are the important things. For vaccine development, so many people they use this structure, spike protein. So I will explain what is the importance or what is the applications of this kind of spike protein later. And this is a nucleic acid. Okay. So RNA is for replication. Okay. The spike protein is for attachment. The virus uses this spike protein to attach into the host cell. நம்ம உடம்புல போய் உள்ள போனோனே அதனால வக்காரும். அதுக்கு இந்த spike protein யூஸ் பண்ணுவோம். ஓகேவா? And what are the types of vaccination? So there are several companies they produce vaccine like Pfizer, Bharat Biotech, Johnson & Johnson, Novavax, and Moderna. So these are the companies. And now, what are the types? Okay, so here in India, Bharat Biotech, so they used to take the SARS coronavirus and they inactivate அந்த வைரஸ் வந்து அடிச்சு ஒரு அந்த பல்லு புண்ணுக்கிற பாம்புன்னு சொல்லலாம். ஒரு பாம்பு இருக்கு, அந்த பாம்பை பல்லு புண்ணுக்கிற பாம்பு. அந்த பாம்பை பல்லு பிடிக்கிட்டாலும் அந்த பாம்பை பார்த்தா உங்களுக்கு பயம் வரும்ல, அதே போல தான் இது. ஸோ அப்ப இந்த சார்ஸ் கொரோனா வைரஸ் இஸ் the chemically inactivated the virus, so it cannot replicate. Okay, so it cannot be replicated. So once if you vaccinate into our body, it produces antibodies. And here the storage is 2 to 8 degrees Celsius. And dosage, we need to make 2 dosage. Okay, so this is the Covaxin and Pfizer, and this is an mRNA virus. Okay, mRNA vaccine. So they used to take the mRNA. So mRNA means, what is mRNA? Messenger RNA. So it sends a message information. Here it is a full virus. Okay, the full virus particle, but it is inactivated. பாம்பு ஆனா பல்லு புடுங்கின பாம்பு. இது encapsulated mRNA virus. It means it is not a full snake. It may be the teeth or any part. அதுதான் பாம்போட பல்லுல கூட வச்சுக்கலாம் நீங்க. ஓகேவா? So this thing. So what they will do, they used to take this mRNA, and this mRNA is vaccine by means of vaccination. So how they will use this vaccination? This mRNA is encoded into the nanoparticle. Okay, so this mRNA particle is it is like a vector. Okay, this mRNA of the SARS coronavirus is encapsulated in the nanoparticle, and this has been used as a vaccine. So which part of mRNA? They use the spike protein. Okay, so why they are using the spike protein means, as I mentioned here, for example, so this spike protein used as for viral attachment. Okay, so this is the full structure of coronavirus. So what the coronavirus will do? So this is the spike. Okay, once this coronavirus enter into my nose or mouth, so it will search for the placement. இப்போ நான் கொரோனா வைரஸ்னா அது அப்படியே தேடிட்டே இருக்கும். ஸோ அது போயிட்டு ஏன்னா உட்கார போயிருக்கும். Okay, this think I am the spike. This is the spike portion, and it will go and attach to our body cell. Okay, this chair is a body cell. Okay, so which part of the body cell means ACE2 receptor. Okay, that in our body there is a particular type of cell is called ACE2. So this spike protein find that it searches that ACE2 receptor. Once after finding the ACE2 receptor, it will go and bind to the spike protein. Okay, go and bind to the other human cells. After binding to the human cell, it will pass its RNA or nucleic acid. Once it passes, once it transfers its nucleic acid, it automatically replicate in the RNA. The single coronavirus, one coronavirus will be multiplied into 100, 100 into 1,000, 1,000 into million. So this is the reason. Okay. So this is the mRNA vaccine, and this is inactivated vaccine. And here the vaccine is produced by adenovirus. Okay, so viral vector vaccine. So here the storage capacity is minus 20 degrees Celsius. And here the subunit vaccine, they use the portion of the virus. Mostly they use a spike protein, that is called subunit virus, subunit vaccination. Here the storage is minus 20 degrees Celsius. And another type of vaccine is same thing, Moderna mRNA vaccine. Here the storage is 2 to 8 degrees Celsius. So most of the countries, they use this Pfizer or Johnson & Johnson. But in India, we use like a Covaxin or Covishield. The major reason is the storage capacity. You can see here the storage is 2 to 8 degrees Celsius. Here the storage is minus 70, minus 20. But in India, not every place is developed. Okay, because so it's very difficult to maintain, or it's very difficult to store the vaccine. Okay, so that is the reason we use like a Covaxin or Covishield, because of the storage capacity. Okay, so next, so I mentioned previously and discussed about the vaccination. So in this kind of vaccination or this kind of medicinal thing, okay, now we are using for vaccination. So initially the coronavirus has been started last year, December 2019. Okay, So almost 1 year, 6 months. Okay, more around 1 year, 6 months. And in the month of in January 2000, maybe 20 or February, so we developed the vaccination, but most of the vaccine are under trial. Okay, so some vaccination they create the phase 1 trial, phase 2 trial, but most of the vaccine not create the phase 3 trial. Okay, but in between that 1 year, 6 months, there is no vaccine at all. Okay, so for the best example, during the corona first wave, last year India experienced the corona first wave. So during the corona first wave, most of the people, since we have the lack of vaccination, many people they depend on the herbal thing. போன வருஷம் வந்து பார்த்தா வேக்சினே இல்ல, மருந்தே இல்ல. ஆனா அந்த கொரோனா தொற்று முதல் அலையில பெரும்பாலும் மக்கள் வந்து எப்படி சமாளிச்சாங்கன்னா, இந்தியாவில் குறிப்பா பார்க்கும்போது இது போல மூலிகை ஒரு மருத்துவம், கபசுப்பு குடிநீர், நிலவேம்பு இல்ல துளசி, அது போன்ற ஒரு இதுதான் பண்ணிட்டு இருந்தோம். So this kind of traditional medicine practice is new? No, it is not new. So this kind of traditional medicine practice has been practiced during the period of Sangam era. Okay, during the period of 2000, 3000 years before. So there is in Puranarnoru, there is a song called Thingini Iravumedu Vembu Manachari. Okay, so it means if you have any infections in ancient time, in the Puranarnoru part it has been mentioned, to get rid of the bacterial infections or viral infection or any type of infections, our Indian ancestors, they used the neem extract for preventing the infections. Next, how our ancestors they protected our herbal medicine or Siddha medicine or Ayurvedic medicine or any type of medicine. How? So in Nattinai there is a poem. Maram sa marundum kollar mandar. Maram sa sagaditudal, மருந்து, கொல்லார், கொல்லுதல், மாந்தர், மனிதர். ஓகே, ஸோ இது எப்படின்னா, வீட்டில் ஒரு வயசானவர் இருக்கிறாரு, ஒரு ராஜா இருக்கிறாரு, அப்ப ஒரு மன்னர் இருக்கிறாரு. அந்த மன்னர் என்னாச்சுன்னா திடீர்னு அவருக்கு வந்து உடம்பு சரியாம போயிடுச்சு, பயங்கர காய்ச்சல் இருக்கு. அப்ப அந்த அந்த வைத்தியர் அந்த 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 அரசுல பார்க்கும்போது ஒரு வைத்தியர் இருப்பாங்க, குடும்ப வைத்தியரோ இல்ல அந்த மன்னர் வைத்தியர் இருப்பாங்க. அந்த வைத்தியர் அந்த போய் சொன்னாங்க, இப்ப மன்னருக்கு உடம்பு முடியலன்ட்டு. அப்ப வைத்தியர் வந்து அந்த மன்னரை கையை பிடிச்சி பாக்குறாரு, அவருடைய நாடி வந்து டிக்ரீசிங், அப்படியே குறைஞ்சிட்டே இருக்கு. ஸோ உடனே என்ன சொல்றாரு, அங்க இருக்கிற ஒரு மந்திரி கிட்ட சொல்லி, நீங்க அங்க போங்க, அந்த காட்டுல ஒரு மூலிகை இருக்கு, அந்த மூலிகை வந்து அத வேரோட பிடிங்கிட்டு வாங்க, பிடுங்கி அந்த வேரை எடுத்து அந்த கஷாயம் பண்ணி அது கொடுத்தீங்கன்னா மன்னர் பொழைச்சுக்குவாருன்னு சொல்றாரு. இதை கேட்ட அந்த மன்னர் என்ன சொல்றாரு, அப்ப அந்த மரத்தை அந்த வேரை பிடிக்கிறீங்கன்னா அந்த மரத்தை வந்து அந்த மரம் அந்த மூலிகை வந்து அதை சாகடித்தல் சமம். அப்ப சொல்றாரு, அந்த மரத்தை அந்த வேரை பிடுங்கிதான் எனக்கு என்னை காப்பாத்துதுன்னா அப்படியேப்பட்ட மருந்து எனக்கு தேவையில்லைன்னு சொல்றாரு. So this is the thing. Okay, so in this way our ancestors they have protected our traditional medicine. Next, so I am from South Korea, so many people you know. So the first case has been reported in China in 2013 December 1. Next to the China, the highly affected country is South Korea. So during the time of February and March 2020, here the cases has been increased. So almost during the month of April, so the case has been increased. The number of infected cases per day, it reached 1,000 cases. Okay, so you can compare the Tamil Nadu and South Korea, the population and also the land structure also the same. South Korea also is a peninsula, Tamil Nadu also is a peninsula. South Korea population around 5.5 to 6 crore, Adgodi, in Tamil Nadu also around 6 crores, 6.5 crores. We can easily compare. Okay, so during that time, even many Indians and many Indian medias, they made a panic. In South Korea, many people, corona has been affected. More than thousands of people has been died due to COVID. So after listening those kind of news, my parents, my friends, my relatives who are in India, they called me and they told, come back to India. That place is not safe. Really, it was a very difficult situation for me that time, because in my life, I belong to 80 kids, 80 born. In my lifetime, I never see such kind of panic condition, particularly this kind of viral disease. Okay, maybe our ancestor, our grandfather or father period, they may have experienced this kind of pandemic or epidemic, like maybe like a cholera or a flu or some chickenpox like this. But I never experienced. Okay, particularly you people also, those people who born in 90s kids or 2000 kids, you people, you don't never experience this kind of thing, and this is the first time. Okay, so in March 2020, in April 2020, South Korea was highly affected, and within the 2 months, they completely they controlled the virus or the virus spread. So particularly South Korea, they handled the 3T technology. 3T means the first T is testing. Here, South Korea is strong in life science, and our second thing, the scientists and politicians they joined and worked together. ஓகே, அதாவது தென்கொரியா எப்படி அவங்க கட்டுப்படுத்தினாங்கன்னா, என்னோட முக்கியமான விஷயம் எதுன்னு பார்த்தீங்கன்னா, அறிவியலும் அரசியலும் இணைந்து செயல்பட்டாங்க. ஓகே, here both the science and the politics they work together. How means only the scientists know how to develop the vaccine, not the politician. Okay, the politicians can make a policy, so only the scientists can know how to control that virus. Okay, doctors know how to treat that virus, but only the scientists and only the researchers know how that virus replicate. So that is the thing. Okay, so since South Korea is strong in biotechnology, so within the short time, okay, in 2019 December, the first case reported in China. In January 2020, the Chinese government they released the sequence. Chinese or any other country, I don't know. They released the SARS coronavirus sequence, DNA sequence. By seeing the DNA sequence, South Korea developed the RT-PCR kit. And this is the way, the reason they did a large number of sampling. Okay, that is the testing. Next, tracing. If I have a corona positive, if I am a COVID positive, okay, so what I will do, I used to travel many places. So I came from my home to my office, but I never came directly to my office. What I did, I just from my home, I started from my home. For example, if I am a COVID positive, so I came, on the way I meet my friend. So that is contact one. Next, I went to the coffee shop. Okay, I bought the coffee. That is second contact. And third, I went to my office room where I discussed with many of my students. Third contact. Now I came. Okay, so 3 people I contact. So think that these 3 people, what they will do, they will go to their home. They go for playing, they go for shopping, they go for church, or they go for temple, or they go for mosque. So this I am one person who are COVID positive. Now what happened? It has been increased at least 300 to 400 people. And this is the reason our Tamil Nadu government or government of India, they make the lockdown. The lockdown, it will not completely get right or completely solve the COVID infection. It will break the COVID virus chain. And the coronavirus paravartha vandu thadikkiradhukku the reason. Okay? That is the reason government gives 14 days period. 14 days or 20 days. In the time la and the virus peru and the mattavanga paravartha thaduthu nirthana and the cases vandu அப்படியே மெயின்டைன் ஆகும். அந்த cases மெயின்டைன் ஆச்சுனா இப்ப ஒரு 1000 பேஷண்ட்ஸ் இருக்காங்கன்னா, இந்த 1000 பேஷண்ட்ஸ்க்கான இன்னும் மருத்துவ கட்டமைப்பு, ஒரு ஹாஸ்பிட்டல் பெட்ஸோ இல்லை ஆக்சிஜனோ இல்லை ஒரு ட்ரக்ஸோ இருக்கோ, அதை நம்மளால மேனேஜ் பண்ண முடியும். இந்த 1000 வந்து 10,000 ஆயிடுச்சுன்னா இருக்கிறது ஒரு 2 ஹாஸ்பிட்டல் தானே, 2 ஆஸ்பத்திரி தானே, அவ்வளவு பேருக்கு பெட் எப்படி போக முடியும்? So that is the reason many people they suffer due to lack of oxygen, they suffer due to lack of beds. So this is the reason. So main thing, how the South Korea's thing, the first thing they did a very good testing. Next, the tracing. Okay, so they traced by using of my debit card and also other thing. Next, good treatment. So this is the thing. Okay, so the earlier one is high-fi modern technology. Like if you want to do some testing, you need to go for RT-PCR other thing. And if you want to go for tracing, they used to check by using the CCTV or debit card or credit card. If I use my debit card or credit card is somewhere else, automatically my number or phone number, the government, they can easily identify. Okay, so this kind of technology. But even the South Korea, that time they use a modern technology. The same period, you can see the March 2020, the functional food, the sale of functional food has been increased. Okay, so why means automatically here in South Korea, the people started to consuming the Korean ginseng. Okay, நம்ம கொரியாவை தமிழ்நாட்டில் எப்படி கபசுப்பு குடிநீர் நிலவம்பு குடிக்கிறோமோ, எப்ப குடிச்சோம்? கபசுப்பு குடிநீர் நிலவம்பு குடிநீர்லாம் வந்து 2000 வருஷமா இருக்கு, 1000 வருஷமா இருக்கு. ஆனா இன்னைக்கு இப்பதானே நம்ம குடிக்கிறோம். ஏன்? ஒரு நோய் தொட்டு வரும்போது தான் அந்த பயத்துல நம்ம குடிக்கிறோம். அதே போல கொரியாவிலையும் இங்க நம்மளுக்கு எப்படி நிலவம்பு குடிநீர் இருக்கோ, கபசுப்பு குடிநீர் இருக்கோ, இங்க இருக்கிற மூலிகையை, இங்க இருக்கிற மருத்துவ தாவரங்களை பருக ஆரம்பிச்சாங்க. You can see that is the reason during the time of pandemic time, many functional foods product has been increased. Not only in Korea, you can see the China also. Chinese traditional Chinese medicine and COVID. So China conducting trials to test the efficiency and safety of trial numbers. Okay, and here, so what is the main reason for lacking of this kind of Siddha medicine and Ayurvedic medicine means? So most of the medicine they have just like an oral approach, but they don't have scientific approach. That is the main drawback for the traditional medicine. Okay, so if you want to practice some herbal medicine or anything means you should have some, you need to conduct some scientific studies. So Tamil Nadu government, they announced the Nilavambu Kudineer and Kabasubu Kudineer, and here there is some reason, like you can see this kind of Nilavambu Kudineer has been reported for antiviral activity and also for chikungunya virus. Next, recently me and my professor in Loyola College, so we conducted a docking study of Kabasubu Kudineer. Okay, so what we did, so Kabasubu Kudineer, so this Kabasubu Kudineer contains 15 plant material. Okay, it is not a single plant. So Nilavambu is a single plant material, but Kabasubu Kudineer, it is a combination of 15 plant. It is called polyherbal drug. அது வந்து ஒரு கூட்டு மூலிகை. So it contains 15 plants. Okay, 15 மூலிகைகள் இருக்கு. So we thought, okay, so Kabasubu, if you drink Kabasubu Kudineer, the viral infection is decreasing, but there is no any mechanism study. So what we did some molecular docking approach. So out of that result, we found, so in these 15 plants, we selected 145 main compounds. Okay, so why we need to study this kind of individual compounds or active compound means, if you want to go for the product, like if you want to go for the product, pharma companies, or if you want to give for a large scale of production, we cannot use the drug for crude. So we should know the active compounds. உதாரணத்துக்கு சொல்ல போனா, இப்ப ஆண்ட்ரோகிராஃபிஸ் பனிக்லோட்டா, இதுதான் நிலவேம்புன்னு சொல்லுவாங்க. இப்ப நிலவேம்புல பார்த்தீங்கன்னா, இப்போ ஒரு மரம், இந்த நிலவேம்பு, இதுல தலை இருக்கு, வேர் இருக்கு, தண்டு இருக்கு, எல்லாமே இருக்கு. அப்ப நிலவேம்புல பார்க்கும்போது அந்த இலையை மட்டும் உபயோகிப்பாங்க, யூஸ் பண்ணுவாங்க. அந்த இலையை சாப்பிடுறோம், அது பச்சை இலைன்னு சொல்லுவாங்க. இப்ப நம்ம ஊர் சைட்ல பார்த்தோம்னா அது பச்சை இலைன்னு சொல்லுவாங்க. அந்த இலையை சாப்பிட்டோன்னே நம்மளுக்கு நோய் குணமாகுது. இப்ப ஒரு சயின்ஸ்ல நம்ம நம்ம we are researchers and we are scientists. நம்ம அறிவியலா பார்க்கும்போது நம்ம அப்படி சொல்லக்கூடாது. அந்த இலையில 1000க்கும் மேற்பட்ட காம்பவுண்ட்ஸ் மூலக்கூறு இருக்கும். அந்த மூலக்கூறுல எதனா ஒண்ணுதான் எடுக்கணும், or ரெண்டா எடுக்கணும். Okay, so if you take a leaf material or plant material, it contains thousands of compounds, but thousands of compounds are not useful for the antiviral or antibacterial or any medicinal activity. Okay, it may be either one compound or two compound or three compound. So we researchers, we need to identify that one compound exactly. Okay, once if you identify that compound exactly, means you can go for treatment for for industrial productions. So this is the thing. So what we did, so we found out, so this Kabasubu Kudineer contain 15 herbal plant material. So out of this 15 plant material, we screen around 145 major compounds. Okay, so for example, Andrographis paniculata. So in this Andrographis paniculata, it contains more than 10 active compounds. Okay, Gingiber officially, Inji, it contains more than 10. So we selected only the active compounds. Okay, So out of this, we found 145 compounds. Out of 145 compounds, we found out 15 compounds are highly responsible to block the viral replications. Okay, so okay, so these are the things. For example, this is a piper. So the main compound is azadirachtin, but piper contains thousands of compounds, but all 1000 compounds are not active for viral inhibition. But this compound we found to be to inhibit the azadirachtin. Next, we can see nilavembu. Okay, so in that nilavembu, the main compound is antigraphene. So that is the thing. So these findings, it has been published in our South Korean news magazine also. That is during the COVID first wave. Okay, you can see this is during the COVID first wave. So that time I feel proud. But now what happening in India, we feel very sad and very distressed. I feel distressed to see the condition, because most of the people die. I feel, my personal opinion, the people, they suffer not because of COVID. Lot of lack of proper infrastructure. So in my opinion, what this kind of pandemic taught us, we don't need like nuclear bombs, or we don't need interballistic missiles. We need a very good hospital. Okay, we don't need to do any nuclear research. We need to do a proper basic science research. The government, both the state government and central government, they need to provide a very good fund for the faculties like you. So you told like your department have 1.2 crores. Okay, so using this 1.2 crores project, you're contributing to some research like this. You need to get the government of India, they need to support universities like you people for doing more kind of innovations. Okay, so here I found in South Korea, they founded like RT-PCR kit, then cost-effective face mask, then this kind of hand sanitizer. So these kind of simple things, many universities they develop. And recently, our chief minister, so he initiated the towards Siddha COVID care for the treatment of COVID patients. For not all COVID patients, the COVID patients who have mild infections and moderate infection. That's why again you need to be very clear. Only 46% or 45% people, even if you have COVID infection, you don't need to worry. If you have under quarantine, if you take very good medicine treatment prescribed by the doctor, nothing to worry. You can be in home quarantine. Okay, 94 to 95%. Only 5% people you need a hospitalization. So for those people, for mild and moderate COVID infections, even our government of India, like the Minister of Oils, they have made a circular. I'm happy to inform that Kabasuba Kudineer and oils have been found useful in the treatment of mild to moderate COVID infection. Okay, mild infections and moderate infection. Okay, again I am making point, mild and moderate infection. Okay, so people who have respiratory problem or heart problems or any other diabetic condition, you need to consult your doctors. Okay, so those people who have like a healthy people, adult people, you can take the Kabasuba Kudineer. That too 40 to 50 ml. Okay, recommended dose. So why this kind of medicinal plant is important means, because medicinal plants, they are very rich in phytocompounds. They have very good flavonoids, vitamins, and carotenoids. And these kind of phytocompounds, they possess a very good. Already there are many reports they have anti-inflammation action, and it stimulate the immune cell. Okay, immunostimulant. And also it can promote the activity of lymphocytes and increase the phagocytosis and interferon productions. So this is the thing. So that is the reason you need to take a lot of good vegetables, colorful vegetables, and also like a practice of herbal medicine. So this kind of practicing the herbal medicine intake, it boosts your immune system. Okay, and another thing, these kind of things you need to practice regularly. You need to practice minimum 1 month or 20 days. ஒரு நாள் 2 நாள் சாப்பிட்டு வர எதுவுமே வராது. Okay, so you need to practice regularly. So here particularly the medicinal plants, you can see the interferon productions. So what is the main role for interproductions? Interferon productions, they are known as cytokines. So used for the communication between the cells, and also it triggers the immune system. Okay, so that is the reason if you have any viral infections, okay, if any virus particle enter in your body, your interferons will be activated. Okay, next the interferon will trigger our immune cells. It will send the message like enemy enter into your body, go and attack like this. Okay, so another important function of interferons, it interfere the viral replications. So interfere the viral replication. Virus பெருக்கத்தை தடுக்கும். So that is the thing. So this is the reason, like most of the herbal plants like Kabasum Kudina or Nilam Kudinil, it can stop the viral replications. உங்களுக்கு வைரஸ் காய்ச்சல் வந்தாலும், கொரோனா வந்தாலும், மைல்ட் டு மாடரேட் வைரஸ் இருந்தாலும் அந்த 10 டேஸ்ல 10 நாள்ல நீங்க இந்த கபசுப்பு குடிநீரோ இல்ல வந்து ஒரு டேப்லெட்டோ, if you take any type of medicine, it will stop the viral replications. For example, as I mentioned, no, so if one virus particle enters in the body, what happens? The virus, particularly the spike protein will go and attach to my cells. Okay, which type of cell? ACE2 receptor. Okay, it go and attach to the ACE2 receptor. Once it attaches to the ACE2 receptor, it will pass the nucleic acid. Next, it will start replicate. After replication, what happened? That one virus will multiply into 10 virus. Next, the 10 virus will multiply into 100. 100 virus will multiply into 1000. So in the meantime, if your body is strong, what happened? Okay, so it will increase the antibodies. So if there's 100 virus, like it will make the 100 antibody cells. So it can neutralize. Okay, the antigen will be neutralized by the antibody. If your body is big, for 100, for example, for 100 virus, if your body produces only 40 antibodies, remaining 60 antigen will be surrounding your body, and this 60 will be multiplied into 6,000. 6,000 into 6 lakhs or 6 million. And once the virus particle is completely replicated, automatically it will arrest all the other body functions. So that is the reason. Okay. Okay. The point is, once if your body exposed any kind of virus particle or any antigen particle, interferon is produced. Once if there is interferon production, that is the reason you feel fever, muscle pain, and flu-like symptoms. Okay, so that's why if you enter nowadays, if you enter anywhere, they have like this thing. They will sense whether you have your body temperature. If you have the body temperature, it means your body have any type of infection, not only COVID, any type of infection. So this is the thing. Okay. So COVID, so most coronavirus, it has been infected more than 200 countries, and until the date is old, but the report is today's report. So today, until 27 million people in India has been affected, but the good news is 24 million people has been recovered. But the sad part is 3 lakhs people, 318,000 people are the death. Okay, so that is the reason to stop the chain transmission. Both the government of India and the Tamil Nadu government, they announced lockdown. So if before here the coronavirus, there are 7 types of coronavirus. Like there are 7 human coronavirus. Alpha coronavirus, in alpha coronavirus 2 strain, and beta coronavirus there are around 5 things. Okay, and here the beta coronavirus, in SARS coronavirus, it belongs to the beta coronavirus family, and it is more virulent. Okay, and this type of coronavirus is more virulent. And this is the structure. So the coronavirus belongs to the nucleic acid is RNA, and the major important portion, it has a spike protein. Okay, a spike protein thing. I mentioned why this spike protein is important, and this spike protein is important for the viral attachment. Okay, it goes and attached to the virus thing. Next, for pharma companies and drug companies, another important enzyme they use, that is 3CL-Pro. Okay, 3-cysteine-like protease. Why this enzyme is important means, once the virus enter into our body, it go and attach to the ACE2 receptor. Okay, after attaching to the ACE receptor, the virus will pass its nucleic acid. So once if this passes RNA, the virus need the enzyme, this kind of enzyme, 3CL protease. Okay, by using this 3CL protease enzyme, it translates. So many drug companies, many pharma companies, they prepare the drug that inhibit this 3CL protease. Okay, so if the drug stop the protease function, the virus cannot replicate. So this is the thing. So why I'm telling you means, so these are the drug target. Like if you want to develop some vaccine, you can concentrate by 3CL protease and spike protein. So spike protein. So these are very important. And this kind of 3CL Pro, already there are many antiviral drugs used for SARS coronavirus type 1 infections. Now we have SARS coronavirus type 2. Okay, so already there are antiviral drugs for SARS coronavirus infection and MERS infection also. So I think now many people you are aware the major symptoms: fever, cough, and breathing difficulties. And so far, now we have vaccine, but research is going on, and many vaccines they have passed the phase 1 trial, phase 2 trial, but some vaccines has been for phase 3 trial. Okay, even vaccination is available. Now people have fear. The main thing is within short time we developed the vaccine. So people they are much concerned about the safety, because we hear a lot of news related to the side effects like that. So similarly, not only for vaccination, also for any antiviral drugs also. For example, in the year 2020, WHO he reported they used hydroxychloroquine for an azithromycin for the SARS coronavirus treatment. So they found this compound, this antiviral compound, they show some side effect. So most of the coronavirus, like they use the symptomatic management. Okay, we used to say noi nadi, noi mudal nadi. If you have fever, to decreasing the fever, they give some drugs like a Dolo or a paracetamol like that. If you have cough, they use another drug. Muscle pain, other drug. Okay, so these are the common symptoms. Now coming to the coronavirus. So why? So coming to the SARS virus, coming to the Capasavucurinir, why government of India they recommend the Capasavucurinir means this particular Capasavucurinir is very good treatment for cough, muscle pain, fever, and for breathing difficulties. Okay, so this is the reason. The COVID. So what is the symptoms of COVID? You have fever, you have cough, you have breathing difficulties. And what is the applications of Capasavucurinir? It is used for the treatment of fever, cough, and things. Since the symptoms are same, so they are used. They recommend the Capasavucurinir for mild and moderate infection. Again, I repeat, for mild and moderate infection. Okay. Here you can see the virus attachment. This is the virus, and here you can see the spike protein. And this spike protein is going to attach to the ACE receptor. Okay. Where this ACE receptor is present? This ACE receptor present in the host inside our body. Okay, in which part of the cell? Okay, so this ACE receptor present in lungs, gastrointestinal tract, kidney, blood vessels. So this is the reason. So this is the reason you need to use face mask. If you wear face mask, you can protect yourself. How means? This is COVID positive patient. Okay, so he is not using face mask. Okay, so as I mentioned, this ACE2 receptor largely, mostly it found in lungs, gastrointestinal tract, kidneys, and blood vessels. Okay, so what this COVID positive patient, if he cough, the virus will be suspending as an aerosol. What is aerosols? Aerosols are nothing but it's a small particles. Okay, droplets. So it will be surrounding within 2 meters or 1 meter. Okay, so distance. So if I cough or sneeze, so the virus particle will be surrounded in this region. I'm COVID positive. Okay, I'm not wearing a mask. So next, another person, he is a COVID negative. So if he comes, if he approach me and if he say hi, how are you means, he is speaking, and he's inhaling. So once he inhale, the virus particle will enter his nose. Okay, after entering into the nose, where it will reach? It will reach to the lungs. So this is the reason why okay, even if you enter into the lungs, where it will go and sit, okay, where it will go and attach, it will go and attach to the ACE2 receptor, because lungs have large number of ACE2 receptor. So this is the reason the COVID patients have the breathing difficulties. Okay, so some scientists, researchers, they told in last COVID, coronavirus, the first wave, the coronavirus, the transmission is slow. The first it attaches to the nose and it enters slowly. But now it is a variant strain, particularly in India, it go and attack directly the lung portion. So that is the reason, without any symptoms, he feel the breathing difficulties, and oxygen level has been decreased. So be careful, always wear mask. And here you can see that this is the SARS coronavirus replication mechanism. So this is a SARS coronavirus, and here this is our body cells, maybe our lungs or anything. So inside our body cells, this is the ACE2 receptor. Okay, so where this spike protein will go and bind, this spike protein will go and bind to the ACE2 receptor. Where this ACE2 receptor is present, this ACE2 receptor is present in lungs, kidneys, or like blood vessels. Okay, so this is one point. And another point, you can see, since the ACE2 receptor present in this kind of important organs, the person who have blood pressure, the person who have already any kidney infections or any other problem, they should take some medicine. Okay, once if they take that medicine, this kind of receptor will be, more number of receptors will be stimulated. So this virus will be feel happy to go and bind or go and attach. So this is the reason. Yeah, ஏற்கனவே நான் சொன்னேன், இந்த ACE2 receptor அதிகமாக எங்க இருக்கு போனா நுரையீரல்ல இருக்கு, கிட்னில இருக்கு, பிளட் வெசல்ஸ்ல எல்லாமே இருக்கு. இப்ப ஏற்கனவே ஒருத்தருக்கு பிளட் பிரஷர் இருக்கு, இல்ல சக்கரை இருக்குன்னா அவர் வந்து மருந்து மாத்திரை எடுப்பாரு. அப்ப மாத்திரை எடுத்தாருன்னா அது என்ன பண்ணுவோம், அவங்க உடம்புல இருக்கு ACE2 receptors வந்து கொஞ்சம் அதிகமா பண்ணிவிடும். ஸோ அப்ப அதிகமாக என்ன ஆகும்னா, இப்போ வைரஸ் வந்து அந்த வைரஸ் வந்து ஈஸியா போயிட்டு உள்ள போய் உட்காந்துரும். அதனாலதான் ஏற்கனவே இருக்கிற ஹார்ட் பேஷண்ட்ஸ் இல்ல பிபி பேஷண்ட்ஸ்க்குலாம் கொஞ்சம் கஷ்டமா இருக்கு. Okay, to protect them, people wear mask. Okay, so now this coronavirus go and attach to the ACE2 receptor. After attachment, it will pass this nucleic acid, and this nucleic acid will translate, go for replication process. So during the replication process, and then it produces the proteins, like first it will make a RNA, next the nucleic acid protein, and spike protein, and membrane protein, and the envelope protein, and this kind of protein will be assembled, I think, in the here in the neuroprosthetic. Next, it will be released, okay, by exocytosis. So this is the mechanism. Okay, so what our target? So our drug target. So if you want to find some medicine, so ACE2, we can block the ACE2 receptor 1 and spike protein blocking second, and it can stop the translation mechanism. Okay, so our research, what we found by means of blocking mechanism, this Cabazova-Coudenir, if you take the Cabazova-Coudenir, it blocks the viral replication. So even if you get infected, if one virus is infected, if you infected with one virus, here it will stop the viral replication. So the one will be the virus one will be one virus. It will be remain as a one virus, and the one virus and the remaining virus, it will be neutralized or killed by our body immune system. நம்ம உடம்புல இருக்க நோய் எதிர்ப்பு சக்தி அது வந்து சமன்படுத்திடும், இல்லைன்னா வந்து சாகடிச்சிடும். Okay, so this is the thing. So that is the reason people wear mask. Okay, so this kind of traditional medicine, as I mentioned, this kind of traditional medicine practice has been it differs from the country to country and from region to region. For example, in Tamil Nadu we use some one practice. If you go for Kerala, they use a different medicine. Okay, but if you go for Uttar Pradesh or Bihar or Madhya Pradesh, it will be different, because traditional medicine is purely depend upon the geographical location and also the climatic conditions. That's it. Okay, so it is an advantage and also disadvantages. The disadvantage is the same Cabazova-Coudenir, if I take, it can work, but the same Cabazova-Coudenir, if I give to the people, to the Kashmir people, it will work or not, I don't know. Okay, so that is a negative. So to support this kind of Siddha medicine or Ayurvedic medicine, we need to do a lot of research. People who are working in biotechnology background or microbiology background, we need to do a lot of this kind of scientific background. People accept science. So this is the best example. For example, so we published an article in Frontiers of Microbiology. So since it has been published in scientific journal about Kawasaki Kudinir, South Korean newspaper, they publish that news because of science, not because of me, because of science. Okay, this Kawasaki Kudinir already people know. Many people know, some people know, and also there are many in Siddha practice, in Siddha literature, it has been reported. But once if you publish in scientifically, that is again I mentioned, now it is 5G technology, means you need to adapt the 5G technology. Don't use first generation and second generation. You will be degraded. Okay, so here you should not feel ego. So once if you adapt with the modern technology, so people accept it. And here, this is the thing, this is the thought for the COVID management. So there are, for COVID, we have the 3 cases, like mild, moderate, and severe cases. For mild category, you can see home-based treatment. So, okay. So, but what these things you don't confirm yourself. Go to the public health center. For every 5 kilometer or 3 kilometer, we have public health center. Go to the public health center. If you have any fever, any symptoms, any infections, or any symptoms or cough or anything, go to the public health center immediately. Okay. And the doctor will recommend. They will check your oxygen level. If your oxygen level is more than above 94, don't need to worry. So you can have here they will give the vitamin C tablet zinc. Okay, this kind of zinc highly present in beef and meat and goat meat. Okay, and people think, and also this kind of zinc, people who have vegetarian, you can take for nuts like dates, almond, walnut, like other things. So you need to think. So this kind of thing. And second case, 90 to 94%. So you need to be careful. And third case, if the oxygen level is below 90, definitely need to be hospitalized. Okay, and don't feel that okay, I'll be okay. I'm okay. I have seen many cases. First day, second day in the hospital, they are very good, and during the time of discharge, tomorrow they will be discharged. So immediately something is happening. So just completely obey what the doctors say. Here, what are the different here? So during this kind of pandemic time, why we completely depend upon the herbal medicine means for developing a drug, it takes nearly 10 to 15 years. Okay, and I can correlate with this with the vaccination also. Why people feel afraid for getting the vaccine means. Getting vaccination, it is not people are not afraid. Okay, you can see many people maybe in 20 years, 30 years before, now even recently also. If the government announced polio vaccination means we are carrying our child and their vaccination. Okay, நம்ம ஊர்ல பார்க்கும்போது கிராமத்துல இருக்கும்போது பார்க்கும்போது வேக்சின் போட இது ஊசி போட்டியா மருந்து போட்டியா தடுப்பூசி போட்டியா போடலையான்ட்டு அங்க ஊர்ல இருக்கிற ஆயா கழிவுகள் என்ன பண்ணுவாங்க, அங்க இருக்கிற பசங்க எல்லாம் கூப்பிட்டு வச்சுட்டு கும்பலா போயிட்டு ஸ்கூல்ல போய் போட்டுட்டு வருவாங்க. இங்க வேக்சினேஷன் யாருக்கும் பயப்பட இல்லை. பிரச்சனை என்னன்னா within short time how this vaccine has been developed. So that is the thing. So people will have doubt, and it is our responsibility, like researchers' responsibilities, government responsibilities, scientists' responsibilities, doctors' responsibility to clarify. Okay, to the doubt. So this is the thing. So because for example polio vaccine, for developing the polio vaccine it takes more than 2000 years. Okay, பைபிள்ல இருக்கு, இயேசுநாதர் சொல்றாருல முடவனை நடக்க வைத்தார். அந்த முடவன் யாரு? கண்டிப்பா போலியோ தான் இருக்கும். அப்ப பைபிள் காலத்துல இருந்திருக்கு. ஆனா வேக்சின் எப்போ வந்தது? 2000 வருஷத்துக்கு அப்புறம் இப்பதான் நம்ம கண்டுபிடிச்சோம். But this kind of COVID vaccine we developed immediately. So people it is nature. They have the doubts. It is a responsibility for the scientists, researchers, governments, officials. We need to clarify the doubts. Okay, this is the general mechanism. Okay, so Siddha medicine. So there are many advantages of Siddha medicine. Like many countries, like even in India also, because of Siddha medicine, Ayurvedic products has been boost the immune powers. And also China is promoting the coronavirus treatment based upon the traditional medicine. Okay, so these are the things. So as I mentioned, as a researcher, okay, the village people, they know this particular plant material can be used for snake bite or viral infections or abdominal pain, but they don't know what type of compound. So therefore, it is our responsibility to identify. For example, this is the plant name Glyceria glaba. Okay, so in this plant, Glyceria glaba, it has been used for the SARS coronavirus. Okay, so in this plant, the main compound glycerin. So it is this compound responsible for the it can stop the viral replication. So here, this plant material glycerin, it inhibits the viral replications, and also it stops the penetration of the virus. Okay, so this is the thing. And last year, our CM also he gave the Carbasuvuculinir and Nilomuculinir for boosting the immune cells. And if you want to do some research, you can see plenty of research article on kind of this thing. Okay, you can see. So don't oh, sorry. You can see here. You can see. So just you are telling lot of examples. Show me some proof. And here the example. This is the example. Okay, this is the antiviral drug Tamiflu. The chemical name is like Oseltamivir. Okay, it is Tamiflu. It is an antiviral drug used for flu vaccine. Okay, influenza virus A and influenza virus B infections. We use Tamiflu, and where this Tamiflu compound has been isolated or identified. This compound has been identified from the plant Illicium verum. Okay, so this is one of the examples. So that is the reason the village people, they know what type of plant material can be used for infection, but they don't know the major compound responsible for the infection, the mechanism. So researchers, professors, we need to identify. Okay, these are the different pet targets. Okay, so coming to the thing, what is the major final part? So what is the major responsible? How this kind of plant material they stop the things? So particularly the plant material, they have the several class of secondary metabolites like the phenolic compound. There are different type of compounds: phenolic compound, alkaloids, sapronins, terpenes. These are the compounds, and each individual compound they have their own activity. For example, terpenes. So these compounds, there are many reports. The terpenes compounds, they have a very active against the Haemophilus influenza and HSV infections. Particularly the compound like alpha terpenes, gamma terpenes, and alpha pinines. These things. Okay, so people, students, if you want to just make people surprised what this kind of chemistry compounds. If you want to understand this kind of compounds, we need to do some analysis that I will teach you. Next, another phenolic compounds. There are many phenolic compounds have been reported for HIV infection, dengue, and HSV infections, and also it has been used for immunomodulatory effects. Okay, flavonoids. Okay, particularly flavonoids present a lot in flavonoids. The major compound present in fruits and vegetables and green vegetables. Color இருக்கிற பழங்கள், பச்சையா இருக்கிற அந்த தலைகள், காய்கறிகள்லாம் சாப்பிடுங்க. அதுல நிறைய flavonoids இருக்கு. Okay, and there are several reports. The flavonoids can be act as an antiviral activity. Okay, it can prevent the viral attachment. It can stop the viral replication at the early stage. Even if the virus is infected or even escape our body immune system, this kind of flavonoids, it stops the transcription and translation process, and even at the final stage also it can prevent the assembly and packaging things, and particularly modulating the immune system. Okay, again I repeat, if you take any herbal, taking a Nilomuculinir or Carbasuvuculinir, you need to practice regularly. Okay, and there are several reports like these are the main compounds used for dengue virus, HIV, chikungunya, Japanese encephalitis virus. The main mechanism, this is the thing. They block the mRNA process, and also they inhibit the virus attachment. There are many processes, and you can see many articles like in 2020, inhibition of SARS coronavirus 3CL protease. The flavonoids, they block the SARS coronavirus things. Similarly, in our report also we found that Carbasuvuculinir content has the flavonoid compounds. It blocked the viral replications. It stopped the 3CL pro mechanism. Once this 3CL pro mechanism enzyme is stopped, the virus will not replicate. And alkaloids, okay, there are many reports, alkaloids reported to antiviral activities. Okay, and here you can see it has been reported the Nilavambu Kudineer is for dengue and chikungunya virus. And curcumin, okay, so curcumin is a very excellent antiviral activity from even from the beginning and the medium and also at the final stage also. If you take the curcumin, so மஞ்சள் நல்லா எடுத்துங்க, மஞ்சள் வந்து அது வந்து ரொம்ப நல்லது. And these are the other material. Okay, so here these are the list of herbal plants. In 10 minutes I will finish the session. These are the list of herbal medicine plants recommended by the Ayush. Okay. Here this is Anthoracophis pinnata, that is Nilavambu Kudineer, the Indian traditional medicine practice. Siddha. Okay. The preparation is only 60 ml decoction. You need to practice for 14 days. Effective against fever and cold. உங்களுக்கு காய்ச்சல் இருக்கு, குளிர் ஜுரம் அடிச்சதுன்னா நீங்க நிலவம்பு குடிநீர் சாப்பிடலாம். எத்தனை நாள் சாப்பிடலாம்? 14 நாள் சாப்பிடலாம். எவ்வளவு சாப்பிடலாம்? 60 ml சாப்பிடலாம். அதுக்கு மேல சாப்பிட்டீங்கன்னா அளவுக்கு மீறினால் அமுதம் நஞ்சு. It become toxic effect. Okay, so above 60 or above 40-50 ml is toxic to your body. So people be aware, please be aware, don't consume large amount of Nilavambu Kudineer or any kind of herbal decoction. Okay, next Adathoda. So this kind of Adathoda is commonly found in rural side. இந்த கிராமத்து சைடுல இருக்கிற பசங்களுக்குலாம் தெரியும், இப்போ நெஞ்சில சளி இருக்கு, இரும்புல இருக்கு, என்ன பண்ணுவாங்க தெரியுமா? அங்க போயிட்டு இந்த ஆவி பிடித்தல் சொல்லுவாங்க. அந்த ஆடத்தோட இலையை பறிச்சு என்ன பண்ணுவாங்க, பாத்திரத்துல போட்டு நல்லா கொதிக்க வச்சு போட்டு ஆவி பிடிப்பாங்க. ஓகே, ஆவி பிடிச்சிங்கன்னா உங்க நெஞ்சில இருக்கிற சளியெல்லாம் இருக்கும். ஸோ ஹியர் ஆடத்தோட லீஃப் practicing Siddha, 2 drops of nostril daily morning, 10 ml twice a day for respiratory infection and fever. Next, Kapasava Kudineer. Here you can see it is available in tablet and also polyherbal formation. Mostly in Tamil Nadu, we follow the polyherbal formation. 60 ml is recommended twice a day. 2 நாள். Okay, ஒரு நாளைக்கு 2 தடவை சாப்பிடணும். If you have fever, cough, sore throat, shortness of breath. So now you can easily understand these symptoms are similar to the SARS coronavirus infection. That is the reason government of Tamil Nadu and India or Ayush, they recommended mild and moderate COVID infections, Kapasava Kudineer. இதனால தான் இந்த Kapasava Kudineer எதுக்கெல்லாம் குணமாகும்னா காய்ச்சல், ஜுரம், வறட்டு தொண்டல், மூச்சு விடுறது கஷ்டமா இருக்கு, அது யூஸ் ஆகும். ஸோ அதனாலதான் Kapasava Kudineer தமிழக அரசும் இந்திய அரசும் இது பண்ணிருக்கு. These are the other plant material. Allium setium, பூண்டு. So it can be used for SARS infections and these things. There are many plant material. So if you want my PPT, you can use this PPT. Okay. So already this kind of plant material has been, many research has been proved. This particularly Nilavambu, it acts as a very good immunomodulator. And particularly curcumin, மஞ்சள் வந்து நல்ல நோய் எதிர்ப்பு சக்தி அதிகமாக்கும். நம்ம யூஸ் பண்ற மஞ்சள் நம்ம ஊர்ல குழம்புக்கு போடுறோம். இங்க கொரியாவில் பார்த்தா இந்த மஞ்சள் just 100 gram it costs around 600 rupees. Okay, you can see. So that is the benefit of curcumin. So ACE2 receptor, this thing. So as I mentioned, this SARS coronavirus, it go and bind to the ACE2 receptor. So what is ACE2 receptor? Means ACE2 receptor is a very important thing. Okay. So what happens? This ACE2 receptor, the major function of ACE2 receptor, it regulates the process such as blood pressure, wound healing, and inflammation. Okay. Once this virus particle and go and block this ACE2 receptor, it stops other function. So that is the reason the COVID patient, they have the sudden respiratory failure or blood pressure, other thing. Okay. So people now is a very good time. So, particularly the faculties or students who are very they want to do some publications at short time. Now you cannot do any practical work, but in laboratory work. So, but since you have some software, by using the laptop, you can simulate your own plant compounds along with the any SARS coronavirus, and you can make some publications, good publications. Okay, so there are many studies like metabolic studies by using the herbal medicine. So given I say many advantages of herbal medicines, there are certain drawbacks of herbal medicine because FDA, food and drug, is not approved. Why means there is no any standard thing. So that's why we need to do more research. Okay, for a simple example, I can say many people we know Kapasapa can inhibit the viral replications or process, but there is no any reported article. If we want to develop some drug, we should identify the exact thing. For identifying the exact thing, we need the scientific background. Okay, so many herbal practice they lack the scientific background. So we need to develop the scientific background. So that is the reason this kind of conference, this kind of like meetings, you can develop, and also you can make a collaboration, particularly with the traditional medicine and modern medicine. You need to work together. So these are the things. What I found in India, we have a large gap between this kind of traditional medicine practice and also modern medicine. But traditional medicine means இப்போ நம்மூர்ல சித்தா மருத்துவம் பெருசா இல்ல வந்து நம்மளுடைய ஆங்கில மருத்துவம் பெருசா சண்டை போட்டு இருக்கிறாங்க. அந்த சண்டையால பாதிக்கப்படுறது யாருன்னா மக்கள் தான், நம்ம தான், நம்மளுடைய அழிய பொறுத்து நம்மளுடைய மருத்துவம் தான். இப்போ ஒரு எடுத்துக்காட்டை பார்த்தீங்கன்னா, இப்போ கிராமத்துல ஒருத்தர் இருக்கிறாரு, இவருக்கு தெரியும் இந்த மூலிகை எங்க இருக்குன்ட்டு, ஆனா அவருக்கு அந்த மூலக்கூறு என்னன்னு தெரியாது. இப்ப நீங்க கல்லூரில இருக்கிறீங்க, இப்ப ஜேபிஆர் கல்லூரியில ஒரு சென்ட் ஜோசப் கல்லூரியில இருக்கீங்க, அந்த மூலக்கூறை பிரித்து எடுக்கிற ஜிசிஎம்எஸ் அந்த டெக்னாலஜி தொழில்நுட்பம் உங்களுக்கு தெரியும், ஹெச்பிஎல்சி அந்த டெக்னாலஜி தொழில்நுட்பம் உங்களுக்கு தெரியும், என்எம்ஆர் அந்த தொழில்நுட்பம் உங்களுக்கு தெரியும். எதுக்கு அந்த தொழில்நுட்பம் தெரிஞ்சா அந்த நிலவங்க குடிநீர் காம்பவுண்ட்ல எது முக்கியமானதை உங்களை ஐடென்டிஃபை பண்ண முடியும். ஆனா இவங்களுக்கு தெரியாது. So that is the reason both traditional medicine and modern medicine they need to work together for identification of compound. Okay, if you identify, you can definitely like combat or we can manage this kind of COVID infections. Okay, so finally this thing. So please stay home, stay safe, and save life. And if you want to do some vaccination program, or you can definitely make some 2 dosage. Okay, so this is my session study. If you want to continue with some 5 or 2 minutes regarding job opportunities, if the professor, if you say yes, I can proceed. Otherwise, I can stop my session.
Sir, you can discuss with the students another 10 more minutes. No problem. Okay. About the opportunities in South Korea. Okay.
Yeah. You ask the students whether they're sleeping or just switch on my.
Oh, everyone is active, sir. No problem.
Okay.
Okay.
Okay, so now I used to discuss about the higher studies opportunities and job opportunities in pharma industries. So our people, what I as a faculty in abroad, now I'm a faculty here in South Korea, what I understand the difference between our Indian students and the foreign students. Our Indian students are highly talented, but the thing is they don't know the proper way. Okay, so for example, so many students, they travel for higher studies like US, UK, Canada, like that, by spending lakhs and lakhs of money. Okay, here in South Korea, we have plenty of master degree program, PhD program, and also postdoctoral program. Okay, because South Korea, they have a lot of top ranking universities globally. If you compare like top 200 universities, in top 200 universities, South Korea hold around 10 to 12 universities. But India, we have only 1 or 2. I'm not comparing, I'm telling the fact. Okay, so these are the top ranking universities. Because why here the South Korea, they have a very good top ranking university means, what I feel, I'm staying in Korea for 7 years. What I observe the South Korean government and South Korean people. So these people, they developed both economically, educationally, and socially within a short time. Within short time of 30 years, they developed economically, socially, and educationally. ஒரு குறுகிய காலத்துல 25 வருடத்துக்குள்ள சமூக முன்னேற்றம், பொருளாதார முன்னேற்றம், கல்வியல் முன்னேற்றமும் அடைஞ்சிருக்கிறாங்க. And this country, they don't have natural resources. அவங்ககிட்ட இயற்கை வளம் கிடையவே இல்லை. How they improve means only by education and human power they achieve. This is the thing. Okay, so by this kind of achievement, the government of South Korea, they provide lot of fundings for research and education. I think around in GDP, they spend around 4.6 or 5, I think, I don't know. The GDP in education and research, they spend high amount of GDP. But in India, we spend only less than 1%. Here they spend more than like 4 or above 5, like that. And here, these are the top-ranking universities, like Seoul National University, Sangam University. So, Q's ranking, you can see 300, 140. These are the top-ranking universities. So, you can make a note. SN University, Sangam University, KS University, Pohang University, Korea University, Ulsan University. These are the top universities. Okay. So, why I am mentioning it? I used to say in Turukal, பொருள் கருவி காலம் எனையிட ஐந்தும் இருள் தீர எண்ணி செயல். Okay, if you want to do some MS opportunities or PhD or research, you should have a very good pre-planning earlier. You need to sacrifice. அதாவது we need to have a very good planning, திட்டமிடுதல். அந்த திட்டமிடல் இதனால தான் இன்னைக்கு வந்து கொரோனா காலத்துல நம்ம ரொம்ப கஷ்டப்பட்டுக்கிறோம். Okay, so if you have some like you need to plan properly. Now we are doing bachelor degree. If you're doing a final degree, like a 3rd year or 4th year, so you need to fix, okay, I need to go for higher studies. Okay, I need to go for job. Okay, I need to go for IT jobs. Okay, I need to go for marriage. I need to do for marriage, or I need to do for business. So you need to fix 3rd year or 4th year. Okay, the problem is here, as I mentioned earlier, we don't have proper guidance. Because most of us have come from the first generation graduate. எல்லாம் முதல் தலைமுறை பட்டதாரி. So நம்ம வீட்ல சொல்லி கொடுக்கிறது ஆள் இல்லை. So ஆனா the thing is, like this kind of institution, like JPR institutions, Satyabama, the professors and faculty, they are providing a very good guidance. Okay, so you need to fix. Okay, I'm going to do master degree. You need to fix, but you need to accept the difficulties what you want to face. That you need to accept. In case if you want to do a master degree, in case you need to do PhD degree, we need to sacrifice. The important thing is money. If you want to do master or PhD, you need to forget about the money. You need to forget about the family life. No boyfriend, no girlfriend or anything. Next, what the society will think. Okay, for example, if you're doing master or PhD, if you complete the bachelor degree, your age will be 21 or 22. If you do master degree, 2 years, like a 25, 24 or 25. PhD, maybe 27 or 28. So within this 28, doing the 28, you need to face lot of problems, and you need to accept that problem. Okay, so once if you accept and if you agree, okay, within this. Until my 5 years, if I feel difficult, if I experience all kind of difficulties, all kind of shame, all kind of thoughts, the second half will be very successful. அதாவது நீங்க படிக்கணும்னு முடிவு பண்ணிட்டீங்கன்னா, மாஸ்டர் டிகிரி பிஹெச்டி படிக்கணும்னு பண்ணீங்கன்னா கண்டிப்பா நீங்க 5 வருஷம் நீங்க வந்து மறந்துடணும். 28 வயசு வரைக்கும் நீங்க மறந்துடணும். கையில காசு இருக்காது, வீட்டுல கல்யாணம் பண்ணணும்னு சொல்லுவாங்க. பொண்ணுங்களா இருந்தா, பசங்களா இருந்தா வேற மாதிரி பிரச்சனையா வரும். அதுக்கப்புறம் சில பேர் கிண்டல் பண்ணுவாங்க. உங்க கூட இருந்த பசங்களே வந்து இல்ல வேற ஐடில இன்ஜினியரிங்கோ இல்ல மெக்கானிக்கல படிச்சுட்டு அவன் வந்து 50,000 ரூபாய் 1 லட்சம் ரூபாய் சம்பளம் இருப்பான். அப்ப நீங்க வந்து ஒரு 20,000 40,000 30,000 ரூபாய் அந்த அளவுக்கு தான் சம்பளம் இருப்பீங்க. அப்ப அந்த கம்பேரிட்டிவ் வரும். உங்க வீட்டுல சொந்தக்காரங்களே சொல்லுவாங்க, அவங்க பேர் அந்த பையன் படிச்சுட்டு அவன் 1 லட்சம் சம்பாதிக்கிறான், நீங்க என்னடா பெண்ணுக்கு. ஸோ இது போன்ற சவால்கள்லாம் நீங்க வந்து இப்பயே நீங்க ஆமா இதெல்லாம் ஏத்துக்கணும். இதை நீங்க ஏத்துக்கணும்னு நீங்க அந்த 5 வருடம் கழிச்சு நீங்க பிஹெச்டியோ மாஸ்டர் டிகிரியோ படிச்சு முடிச்சீங்கன்னா அந்த செகண்ட் ஹாஃப் சூப்பரா இருக்கும். அவங்களுக்கு ஃபர்ஸ்ட் ஹாஃப் நல்லா இருக்கும், ஆனா செகண்ட் ஹாஃப் போயிடும். உங்களுக்கு ஃபர்ஸ்ட் ஹாஃப் ரொம்ப கஷ்டப்படணும், ஆனா செகண்ட் ஹாஃப் சூப்பரா இருக்கும். ஆனா நீங்க ஃபர்ஸ்ட் ஹாஃப் கஷ்டப்படும் போது தனியா தான் இருப்பீங்க, பிரச்சனை இல்லை. ஆனா செகண்ட் ஹாஃப் வந்து பாத்தீங்கன்னா நல்லா இருக்கும், அது ஸ்மூத்தா போயிடும். Okay, so we need to think like that. That's first point. And second, if you want to go for higher studies, sorry, not higher studies, if you go for companies like pharma companies or biotech companies, you need to survive. உலகத்தோட ஒட்ட ஒழுகல் அந்த கம்பெனில என்ன தேவையோ அதை நீங்க தேடணும். Universities and colleges will provide only a degree. Okay, first you understand. You can use as a ladder. அவ்வளவுதான். அதாவது it is a qualification. இந்த அந்த vote ID இருக்குல்ல, vote ID இருந்துச்சுன்னா voter ID இருந்ததுன்னா நீ ஓட்டு போடலாம். அவ்வளவுதான். அதே போல டிகிரி பிடெக் எம்டெக் இஸ் டிகிரி, தட்ஸ் ஆல். பட் யூ நீட் டு டெவலப் யுவர் ஓன் டெக்னிக்ஸ், யூ நீட் டு டெவலப் யுவர் ஓன் ஸ்கில். அது உங்ககிட்ட தான் இருக்கு. ஓகே, நாட் த யூனிவர்சிட்டி ஆர் others will not provide. You need to think. Okay. Okay, for master degree, you can see those who want to search for master degree or PhD opportunities. So that is a two-way approach. The one approach is if you go to the university, for this is my university. If you go to the university website, you can see the news like a flashing. In the news flashing, you can see the university, they make a bulletin like a master student applications are wanted, PhD applications are wanted, international students are wanted. So you can, so that is one point. That is one thing. So that is little difficult because since it is public, this kind of announcement is publicly available. Lot of competition and many people will approach. Case one. And now what I'm telling is the case two. The case two is individual approach. தனியா நீங்க போய் ப்ரோபோஸ் பண்றது, தனியா நீங்க போய் அப்ரோச் பண்றது, தனியா நீங்க போய் கன்வின்ஸ் பண்றது. Okay, so the case two is individual thing. So this is the way where I did and most of the students they did. Okay, so first select any university. As I mentioned, so South Korea, they have a lot of top ranking university. Okay, this I mentioned few. So you can select some 20 university, top ranking university. Okay, why you need to select the top 20 or 25 university means in South Korea, the medium of education until from the schools to the graduation is Korean language. Master degree, PhD is English language. So if you choose top 20 or 25 universities, the bachelor and master will be in English medium. Okay, so there is no problem for the international people like us. Okay, so you need to choose which university you want. For example, Seoul International University or Sangam University or Korea University. So you choose any university, one. Okay, so for example, Sejong University. So if you check the website, you can see there are many columns like about Sejong, academic, admission. So you go for academic. If you select academic, you can see there are many columns. Under this column, you can have the faculty. Under this faculty, you can see there are different departments. College of Liberal Arts, Social Science. So my department is College of Life Science. Under this life science, there are four departments: food science, biotechnology, molecular biology, bioresource department. Okay. Next, if you select the food science department, means you can have like many professors will be there. Okay. So one department, for example, food science department, have a minimum 8 professors. Okay, so if you go for the 8 professors individually, his name is Professor 1, like a So, second Professor Hung, third Professor Sang Ho, fourth Professor Kui, and like each department have minimum 8 to 10 professors. Okay, each professor they have their own major. Because see, the Professor 1 is major as daily processing, functional foods, nanofoods. Second professor microbiology, third professor food chemistry, fourth professor biotransformation or mass transformation or energy enzyme kinetics or other thing. So therefore, based upon your interest, you need to choose your professor. உங்களுக்கு எந்த professor உங்களுடைய ஆய்வுக்கு உங்களுடைய விருப்பத்துக்கு இருக்காரோ அவரை நீங்க choose பண்ணணும். Choose பண்ணிட்டு after selection you need to send him a mail. Okay, email. Okay, so before sending the email, particularly while you are pursuing your BTech degree, while you are pursuing your master degree, you need to fulfill these 3 criteria. Okay, the first criteria, you should have IELTS or TOEFL. In Korea, minimum score is okay. Even if you have 6.5 or 7, easy. So most of our Indian students, particularly for Tamil students or Tamil Nadu students, or particularly people studying in Tamil Nadu universities or Tamil Nadu colleges, they can clear at first attempt itself. So IELTS. Next, you should have minimum 2 SCA publications, maybe any author, first author or SCA publication or Scopus publication. And third, you should have a 2 conference presentation. Why you need this? Okay, so IELTS means it is a qualification as you have a very good knowledge in English. Okay, this kind of certification is not for language fluency or other thing. Since we are in scientific background, we will do research. Okay, after doing the research, what we will do? We will convert the research into product. For applying, for converting the product, you need to apply or you need to submit your data. For submitting the data, you should have very good language skill. So that is the reason you require IELTS. Second criteria, scientific publication. Why you should have scientific publication means the education between the Korea and India and abroad is different. In India, so most of the, even for master also, master degree, it is theoretical oriented. Only 1 year we have practical oriented, but mostly we have a theoretical oriented. Like students will go to the classroom and professor will come and he will teach class. And sometimes they do some practical. But Korea is not like that. Korea, if you go for Europe or US, like not like that. What they will do? The professor, you will give one topic. For example, food chemistry topic. Okay. For example, a student name is Ramasamy. Okay. So student name is Ramasamy. So I am a professor. So I will call the student, Ramasamy, come here. Your topic of research is food chemistry. That's all. I will give only the topic. The student, what he need to do, he need to think. Okay, on food chemistry, what type of research I can do. Next, for example, like I will choose one topic, identification of chemical compounds present in Kabasubakudi near. That is the title. Okay. Next, I need to design the project. How I can identify the compound, how I can isolate the compound, I think. So that is materials and method. Okay. For identifying the compound, isolation of the compound, I need some techniques. Okay. So that thing I need to think. Next, you use some statistical analysis, statistical data for comparative analysis. For compared to the control, positive control, our plant compound shows very good activity. That is statistical analysis. So once if you do some publication, you will experience this kind of things. Okay, not this kind of experience will come only by practical approach, not by theoretical approach. You understand? So therefore, students for either now we're pursuing BTech final year or third year or fourth year, or MTech third year or fourth year. From now itself, you need to contact your professor, because under the biotech department, you have several professors. One professor, he may be major in microbiology. Another professor, he may be in mass transfer. Another professor, he may be in genetic engineering. So based upon your interest, you choose your professor and design one project and try to publish your article. Next, conference presentation. You need to present the paper. You need to attend this kind of conference. The main advantages of attending this kind of conference and presenting your conference research findings means it will boost your immunity, it will boost your confidence. நாலு பேர்கிட்ட பேச தான் உங்களுக்கு அதுல வந்து என்னென்னலாம் சரி இருக்கு, எது தவறு இருக்கு, எது சரியா இருக்குன்னு தெரியும். Once if you present your research papers, many professors, they give some comments. They give some negative comments or positive comments. You accept that. If it is negative comments, you need to accept. ஆமா என்கிட்ட குறை இருக்கு, என்கிட்ட தப்பு இருக்கு. So you can rectify the comments. Okay, so that is the reason. So how you can make, for example, so this is the example. This is the this is one research article. Anti-dengue activity of bioactivity of Nilavambu against the dengue vector. Okay, so here for finding this activity, what are the techniques they use? You can see they use DCMS, they use LCMS, they use HPLC, UV, spectroscopy, SEM, TEM, PCR, sequencing, cell culture. These are the techniques. Okay, so I'm not telling you need to learn all these techniques. No, if you want to go to the if your interest is chemistry, in GCMS, LCMS, HPLC, you should learn at least 1 or 2 equipments is okay, not everything. If you want to be a very good molecular biologist or cell biologist, you should know PCR or cell culture. Any 2 is okay. If you know everything, you are very smart. Okay, so once if you design the project and if you write the project and if you publish the project, then it is a data like you are very qualified enough. Okay, so now the point is, okay, so IELTS, it is a certificate that you have very good qualification in language. And second, SCA publication. If you have FCA publication, means the professor will automatically believe you, okay, this student, for example, if you publish this paper, this article, okay, you publish this article, so automatically the professor will understand, okay, this candidate, he can in this research paper, he used DCMS, he used LCMS, he used SPLC, he used sequencing techniques, cell culture. So this is the proof. Not by giving the recommendation letter, by like your HOD or any other recommendation, no professor will believe. Your article, research article is your certification. So therefore you need to make a publication, okay? So this is for higher studies opportunities. Next, for job opportunities, you can see, for example, if you search for any companies, like a pharma companies, here what is the skill they are asking? UV, GC, HPLC. If you go for chemistry, like Orchid Pharma, biotech, any biotech companies. So these are the things. See, these are the techniques. What is the salary? 3 lakhs to 4 lakhs. Okay. So if you want to become like a molecular biologist or cell biologist, you should know this kind of cell culture, blotting culture, DCMS, flow cytometer. So how these kind of cultures or techniques you can learn means not by attending some workshops or not by attending the conference you cannot gain. By practical experience you can gain. So that is the reason during the final year semester you decide now itself and you can continue the projects. Okay, so it says these are the examples. Next, some students, they don't want to do the lab work, but they are very good in softwares. Like they are very good in Java programming, or C++, or SAS programming. Those people, they have very good opportunities, even abroad and India also. You can see the per month salary is like 1 lakh to 1.5 lakh like salary. Even for my research work also, I am getting help. Some of the Korean students, they used to get, they are only like a bachelor degree, but they have very good bioinformatics tools like R program, Python program, and C other program. So they are getting very good salary. So people, like I told 3 points. Okay, the first students who want to do their master degree or higher studies, the first thing they should fulfill this criteria: IELTS, publication, and conference facilitation. Second point, those who want to go for pharma companies like Orchid Pharma or Biocon or some GVK Bioscience or any chemistry, any chemical companies, a lot of chemical companies in Tamil Nadu. Particularly this COVID time, the pharma companies has been increased. So you should know these kind of techniques. I'm giving many examples. See, these are QC, production chemist, SOFIC. See, they are analytical chemist, TLC, GC. You can see these are the things. Okay. And this is the software. You can see this is the software thing. Okay. And this is another example. By means of publication only, you can experience this kind of techniques. Okay, and you sometimes like a conference, like a call center jobs also, like a healthcare jobs. Okay, you can go like the degree is BSc, MSc, like any BTech degree also. Mostly like insurance companies. There are several companies in Ambattur, like many companies are there. Next, research associate. Currently, in this COVID time, many like SRM universities, many institutes, they are conducting the clinical trial. They have the vaccination. For vaccination, they are conducting phase 1 trial, phase 2, phase 3 trial. So the doctors, nurse, and scientists, they will give the drug. But this kind of statistical, they need to, who will perform? For performing those kind of practical things, the clinical research associate jobs is a very good salary, you can see. But you need to have some training, I think. Maybe in Bangalore and Chennai also, some companies, they have the like this kind of companies, like thing. So these are the several divisions. Like for example, like chemical analysis is a job. Molecular biology is kind of one job. Cell biology is another job. Similarly, in this kind of clinical research, you can see there are many courses. They have very good high salary, like 1 lakh to 2 lakhs per month or per annum also. So that is the reason. These are the list of biotech companies. You can see Biocon, Serum Institute of India. Serum Institute of India, now this company is producing the vaccine. I think Covishield, I think. NSA Biotech, Piramal Healthcare, Wockhardt, GlaxoSmith, Bharat Serum. There are many companies, and these are the other companies, AstraZeneca. So these are the many companies. So what you need to do, you need to go to the company website. Okay, you can see. For example, I'm giving one example. This is on company 1 or company 2. So go to the company website, check the current job openings. Under the current job openings, you can see these are the vacancy. Okay. So under this vacancy, for example, if you belong to the chemistry background or if you want to belong to the microbiology background, you can choose. Sometimes some students, okay, I want to change my course. I don't want a biotech background. I want to go for business. So after a BTech, you can do for MBA. So once if you do for MBA, since you have some life science knowledge, you can become as a business development manager in the pharma companies. Okay. Okay. Now this is the current job openings. Under the current job openings, these are the things you can see in the pharma sector. So what are the techniques? Okay, as I mentioned, LCMS, SPLC, LSR, okay, and animal handling and HPLC. So these are the techniques. Again I repeat, what the university degree just is an entry point. But if you want to be stable, if you want to be survey successfully, you should invest your own hard work, and you need to invest your own techniques. Okay. For example, best thing I can say, Dhanush, and Turkul used to say, "Nunniye nul pada karpin." நீங்க என்னதான் நீங்க புக்ஸ் படிச்சாலும், என்னதான் வந்து பக்கமா படிச்சாலும், அதெல்லாம் உங்களுக்கு வந்து வராது. அது வந்து ஒரு என்ட்ரியா இருக்கும். நீங்க ஐஐடியில படிச்சாலும் சரி, ஜேபில படிச்சாலும் சரி, சத்யபாமால படிச்சாலும் சரி, லோயலால படிச்சாலும் சரி, அது ஒரு என்ட்ரி. அந்த என்ட்ரிக்கு அப்புறம் நீங்க உங்களை நிலைநிறுத்தத்துக்கு நீங்க உங்களை வந்து முன்னுக்கு கொண்டு வரணும், உங்களை நிரூபிக்கணும். Okay, once like this kind of like a degree, BTech degree, MTech degree is called entry. But to be successful, you need to prove yourself. You should be multi-talented. Okay. For example, if you are a molecular biologist, you should know some other technique like a GCMS technique or chemistry technique or biochemistry techniques or bioinformatics techniques. For example, Dhanush, he is an actor. He is not only performing actor, he is singing, he is dancing, he is making a film production. Adida. So that's why he is being a successful star. அவர் படம் மட்டும் நடிக்கல, நல்லா நடிக்கிறாரு, படம் எழுதுறாரு, டான்ஸ் ஆடுறாரு. So this is the thing. Okay, so for being successful, to be a champion, you need to prove yourself. Adida. So these are the companies. And here I showed this is the best example. These are the techniques you should know. And here the live example. I'm saying Arcade Pharma. You can see business. You should have a BTech and MBA degree, and marketing. And QC, for QC, like you should know the this kind of GCMS, HPLC, LSR, this kind of analytical techniques you should know. And for biotech company, for same in Arcade in biotech division, definitely you should know the PCR, gene cloning, protein expression, like throughput screening or any other method. So don't confuse. So you need to fix. Okay, I like this strategy. I love this technique. Okay, I am strong in chemistry. You develop, or you can you learn a lot of those kind of chemistry techniques. You can next. Okay, I'm interested in molecular biology, so you can do the PCR techniques, cloning like that. Next, okay, I'm very much good. I'm interested in bioinformatics. You fix one thing. Okay, so based upon interest, you can perform, but it takes some time. You need to be patient. Okay, these are the other companies you can see. You can see a lot of vacancy, like you can see all they ask like a analytical method, HPLC, GC, cytotoxic, cell work. And here next to some people they are very good in marketing. Okay, so some people they have very good marketing. நீங்க சும்மா பேசினாலே ஒரு காத்த கூட வித்துட்டு வந்துருவாங்க. So those people who have very good skill in talking to you or they to how to impress people, how to convince people, they can go for medical representative. They have very good opportunities. This is for jobs for hospital. I think people don't need. And biostatistic. Okay, I think you are, since you are from most of the people you have some you will have some software. I think maybe Max or some software, a software program. So better learn SAP and SAS. So those people who complete the SAP course and SAS course, you have very good opportunities. Okay, many companies, particularly in Bangalore, Chennai, and even in Singapore, US, Canada, those people who complete the SAS and SAS program, they have very good opportunities. Call center jobs also is there for life science students. Okay. For so those people who want to apply for master degree and PhD, there are some website. You can see this is the professor, the department, this is the university, and this is the professor, and this is the contact email. Okay. So to this, you need to take this email and you need to make a covering letter. Dear professor, I'm interested to do master degree or PhD program under your guidelines. So my research interest is so and so. And so based upon the research, I publish the article. Next, I cleared IELTS. Next, I clear and I have the 2 conference presentation. So based upon my experience, kindly consider my application. So you send a request email to your professor. Definitely they will accept. Okay. And another thing, don't send same letter to the same department. Okay. If you select one university, means one university, one professor, one time. Okay. Next, another university, another professor. I came to know many students, what they will do, they will make a 1 copy of the letter, and the same department, like they will send the same letter to the 8 professors. It is a wrong habit. Never do this. Okay, so this is the thing. So finally, I conclude my study. So once again, I thank the JPR institution for giving the opportunities, and also for the students for listening patiently my long speech. Thank you once again. Thank you.
Thank you, sir. Sir, thank you, sir, for enlightening us on this importance of herbal compounds in our metabolism, and also for giving us the glimpses of education and job opportunity in South Korea. Sir, now we have a question from a participant, and the question is, if a person has a diabetic or blood pressure, is there any sort of test to be done prior before the vaccination?
Yeah, definitely. You need to mention to the doctors before vaccination. You need to check whether your blood pressure level is low or correct, or your sugar level is low or correct. You need to check. Then you need to go for vaccination. Like for example, like normal for child vaccination, what they will do, they will ask you, whether the baby have fever or cough, like that. The same thing. So you need to before vaccination, you need to check the people who have diabetics or any other medical history. They need to mention the point.
Okay, sir. Thank you, sir. Now let's move on to the vote of thanks session given by Dr. Justin, sir.
Good afternoon. It's really a great pleasure to see you all online in this BioTalk program version 2. Really, it is a awesome lecture, Professor Arogyaraj Raj. Thank you especially for you. I just want to say a few words about him. Dr. Arogyaraj Raj is always involved in various active debates in different TV channels in Tamil as well as other languages. And he has also involved himself in writing various articles in dailies. Specifically, last week, I have seen one article in Dinathanthi. Am I correct, sir?
Yeah.
Yes. So he is a person involved himself in active research. Okay. And Really, he has brought all of us to the Sangam literature period, and he has explained. The explanation is very nice, and he has given a very excellent talk on how best the South Koreans are coming out from this uh, viral infection. What are the methodologies they adopt, all those things. He has explained everything in a very nice manner. So thank you once again, Dr. Arokiraj, for your presentation. Thank you. Thanks a lot. And I would like to mention a special thanks to our chairman and our managing director, ma'am, and the director, sir, as well as the principal for their constant support and encouragement. I also would like to thank our dean, ma'am, and our head of the department, Dr. Sri Kumar, and lab HOD, Dr. Renuka, ma'am, for their constant encouragement. I also thank especially our faculty members for their support, and specifically I just want to thank our counselors for informing all the students and asking them to join this program on time. Not but least, without the participants, there is no point in conducting such a program. I would like to thank all our students, specifically the student coordinator, Mr. Alfred, for organizing this program in a successful manner. Once again, I thank each and every one of you. With these few words, I just hand over the session to Mr. Alfred.
Thank you, sir. So, finally, I'd like to thank you all the participants for joining the event, and we hope to see you soon once again with another interesting topic in the upcoming weeks. I would like to conclude the event with a quote. The beautiful thing about learning is nobody can take it away from you. Thank you.
Okay, sir. Thank you.
Thank you, sir.